my name is Sam, and today I'm going to be performing an NG bolus feeding. Hi, my name is Sam. I'm going to be your nurse today. Can you tell me your name and date of birth? Okay, that does match the wristband. Today I'm going to be giving you a feeding through your NG tube. Is that all right? Okay, great. And are you feeling any pain today? Okay, my patient states that he has no pain. I'm going to go perform hand hygiene and I'll gather my supplies. Gather my supplies. Perform hand hygiene. I'm also just going to perform provide privacy. Okay. So I will apply clean gloves. Okay, I'm just going to raise my patient's bed up to a good working level. Just going to feel yourself going up, okay? And I'm going to just lay your head flat down. I'm laying my patient's head flat so I can perform an abdominal assessment. Okay, I'm going to reveal the area, being careful to maintain my patient's privacy. I'm going to inspect for any distension, any sores, any lesions, anything like that. Everything looks good upon inspection. I'm going to auscultate the 4 quadrants, starting in the right lower quadrant. Okay, and there were active bowel sounds in all 4 quadrants. I'm going to percuss. Okay, everything sounded good. Now I'm just going to palpate. Okay, everything felt good, so I'm going to cover my patient back up. He didn't feel any pain throughout that, which is good. I'm going to sit your head up, okay? We want him at a 30 to 45 degree angle. Okay, now I'm going to gather my supplies. I'm just going to put the chuck pad underneath the patient to prevent any spilling. Okay. I'm going to set up my chuck pad, pull my table up. I'm going to check the expiration date, the type of feeding this is, make sure it adds up with the doctor's orders. It does. If it was open and it was a can, I would want to get a rubbing alcohol wipe and rub it off. This one is open and it's within the 24-hour period, so I'm just going to lip it. Okay, and I have that all ready. I have my sterile water here ready to flush, and I have my 3 syringes in my container. I'm also going to set up a pH strip. And before I do any of this, I am also going to measure the length of this. Okay, and it's at about 35 inches, which adds up with the previous documentation from the last shift. I'm also going to look at the x-ray and confirm that it is where it needs to be. Everything is appropriate with the positioning. So I'm going to clamp. I just want to take a small amount of stomach contents out to test the pH. I'm just going to unclamp and do about 10 cc's. Okay, we're going to clamp that back up. All right, I'm just going to put this on the pH strip. Okay, and the pH is at 4.7, which is perfect. It shows that it is in the stomach. Okay, so I'm going to clamp this again. I want to take out the rest of the stomach contents. I'm gonna unclamp. Clamp again. Okay, and I just want to do it one more time, make sure I get everything out. am starting to feel resistance, so that shows that I got everything that's in there. Just gonna put this in. I wanna make sure that the amount does not exceed 250. I would not continue with the feeding. I would wanna go alert the physician if it was above 250. It's not, it's at about 100. It's a milky color. It looks appropriate for how it should. So I'm gonna gather a new syringe. Going to clamp this. And I'm going to slowly pour the contents back into the container. Lower goes slower, higher goes faster. So I'm just gonna make sure it's going at a good speed that my patient can tolerate. All right, so everything is back in there. I'm gonna remove the syringe. Next, I am going to, oh, before I do that, actually, I do want to flush it, make sure I got everything out. So I'm going to take my sterile water and pour about 15 to 30 cc's in. Okay, great. I flushed all the remaining contents in. Okay, now I can begin with my feeding. I already checked, make sure it was the appropriate feeding and it was not expired, and I cleaned it as needed and lipped it. So I am going to gather a new clean syringe. I'm just going to clamp this. And I'm slowly going to administer my patient his feeding. I want it about 3/4 of the way full, and once it gets to about 1/4 of the way full, I want to add more. I don't want it to completely empty out. Again, lower for slower, higher for faster, so I want to maintain a good speed. I did feed the amount that the physician ordered, so I'm gonna clamp this back up real quick, grab my sterile water, and I want to do another 15 to 30 cc's. Okay. I'm going to clamp this back up, and I'm going to pin this back onto my patient's shoulder. Okay. I'm going to gather my supplies and get rid of them, discard appropriately. I'm going to keep my patient at a 30 to 45 degree angle for the next hour. I want to make sure that he tolerates the feeding appropriately, so I'll come back and check and make sure he did. I'm going to lower the bed down to the appropriate position. Okay, and here's your call light. If I can get you anything, just let me know, okay? Thank you.